Mm-hmm. I've got their chart right here. Okay. I can keep it down, yes. Sure. Thank you so much, Catherine. Okay. I'll be out in a bit. Hello. My name is Dr. Fobella, and I am the doctor who is going to be assessing you today for lip injections. Is that correct? Absolutely. We'll go over your chart here and see what you filled out in the waiting room. Did you have a pleasant experience out there? Oh, the nervousness. That was just from one of our regulars. They tend to come in here and they have a little bit of an addiction. And we like to prevent that, so today we're trying to keep it down so our other doctor can talk to them about potentially giving it a break, because you find that plastic surgery, the ability to change one's body in an instant, things that we never thought we could manipulate, you know, can be very rewarding, but in the long run, it's not very good. So we do want to point that out right away. Your injections, if you do plan on getting the injections today, will only last you 6 months. They will never last forever. Kylie Jenner we like to use as a perfect example, because she chose to let her fillers go down, and she still gets fillers. I can promise you that. No filler lasts forever unless you're injecting with something that's not on the market. So with that being said, let's go over your chart a little bit. I'll do an assessment on your face. Before that, I want to have you make sure you want the injections, because I have some numbing cream. Injections don't hurt at all. They actually kind of tingle a bit. It's 100%. I get injections in my lips. If I could go back, would I not? Absolutely. I kind of feel like I look like the Joker. But you know what they say. No, what do they say? You don't know either. No problem. You sit back and relax, and I will take care of the rest. So, let's start with going over your health history. So, do you know if you are allergic to anything at all? It says no here, but I just want to make sure. Okay. Have you ever had any surgeries before regarding plastic surgeries? Now, that can even be dental work. Removal of teeth can be considered a plastic surgery depending on the reason for the removal. Okay. When was this? You can just give me a vague date. It's okay. Do you take any medications? Okay. Is that often, rarely, or never even an option? Mm-hmm. Okay. Now, are you familiar with lip injections? A little bit? Okay, well, again, all I do, assess your face. I'm going to show you a little chart. It's a drawn-up chart because some surgeons' offices are different from others. There's some that take pictures, like, for example, if you bring in a picture of Kylie Jenner or anybody who you enjoy the shape of their lips, they can go off and try to make that shape, but ultimately the shape of their face, eyes, nose, the symmetrical values of their face are really what dictates the way the after effect will look. So I'm going to go ahead and assess your face before we do the injections while the numbing cream sets in, and we'll decide if you want more plump on the upper lip, lower lip, anywhere else. Okay? Yes. So we got your medication, and you do know the price of lip injections, correct? They told you out front? Well, there's 3 types. There's Fobella, which is my name, Restylane, and Juvederm. Those are the 3 typical main ones. Now there's Juvederm XL, Juvederm, Silk. There's all kinds of different, but we're just going to stick to the regular terms today. Juvederm is a mostly harder, thicker solution that gives the lips like a plumpness. It's kind of, you know what I mean. Volbella is the softest there is. Soft, supple lips, but you have to get them redone almost every 3 months. Then there's Restylane, which kind of lies in between. And Restylane is I got lipstick on me. Restylane is a little bit more painful to get injected. Now, I do tend to start out everybody with Juvederm. And if you don't mind, may I touch your lips? Okay, we're going to use a makeup wipe to just wipe around the face in case there's any germs or bacteria. The wipes that I have are also alcohol-based. That doesn't affect your skin. There's allergies, and then there is reactions. Doesn't have to be an allergy. You could just have sensitive skin, and we want to keep the sensitivity as low as possible, as afterwards you will have a significant amount of swelling. Okay. So let me just go ahead and check your lips very quickly. Okay. Excuse me, I felt something in my mouth. It's a rainy day out today, isn't it? Can you go ahead and make a pouty face for me? Go. Okay, I need you to squeeze your face all together. I personally can't have too much Botox in my face. Okay. Alright, can you go and make a kissy face? Great. Thank you so much. So, I mean, that's really all I have regarding needing your information. If we were ever to do other things like Botox, I would need a note from your doctor. Some people get Botox for aesthetic values. Other people get Botox because they suffer from migraines. Allergies create swelling in the face. Botox helps prevent swelling in certain areas, which would cause congestion and things like that. To be completely honest, as a surgeon, it's completely sad how much society has come to. Lip injections and Botox and things like that were originally created just to enhance, not permanently change somebody's appearance 100% to where they're no longer recognizable. And if I think that you are doing too much, I will tell you straight up and you will not be allowed back in my office if I find that you are coming with an addiction. That is exactly why I'm keeping my voice low and somebody's in the other room. So let's get started with these. So, you're 100% sure you want these injections, correct? I need your 100% consent. You signed 3 papers. I personally need a direct verbal consent, okay? Okay. So I'm just going to brush that up here. Let me grab the numbing cream. So this is kind of looks like A&D ointment, but it's really a liquid. I'm gonna smear it around your mouth. Before I do that, I'm going to wipe your mouth again with the makeup wipes. And while you're gonna feel lots of tingles. Lots of tingles. And then you'll feel the numbing, okay? Now, again, if your skin is sensitive, it might actually burn a bit, but I promise only for a couple seconds. Okay. So what's the weather like out there, really? Yeah. I figured. Now these are specifically for sensitive skin right here. Excuse me, are you thirsty by chance? And you did drink water before you came? It's no problem if you did. I just want to make sure that after you have these injections, you stay hydrated no matter what, okay? that you have around the mouth, I will be removing. Now, if we have any Juvederm left in the syringe, would you like me to inject it around here for your smile lines? I personally have it, so usually the lines would actually go all the way up to my nose, but it's kind of just staying right here. I don't personally recommend it. Do you mind if I? Thank you. Hold on. Can you smile for me real big? All your teeth? Let's see here. Absolutely not. Yeah. Unfortunately, we can't save the Juvederm for next time, okay? It's a health hazard. Okay, so I'm just going to go ahead and wipe you down. Let me grab the numbing cream. So I don't get anything on my hands regarding the cream. I'm just going to throw this glove on here. Again, it looks exactly like A&D ointment, but it's not. Okay. Ready? It's gonna be a lot, but we'll wipe you off at the end, okay? Remove the gloves. Now, I don't need to wear gloves to put the injection. It's a brand new syringe, and pop off the top, and so while we let that sit for a little bit, let's choose our injections, okay? Shape. I'm gonna assess your face, but can you tell me from this amateur drawing which pair of lips you like the best? Well, let's see. The angelic, we would take a Q-tip and stick it in between right here and hold down and inject around, so it gives you like a pout. Then we've got the pout itself, which is the whole syringe. We just fit in your lips. For me, they inject up here. If I do this, you can see the little balls of injection. And then there's the filled. Now the filled is where the lower lip is kind of more full than the upper lip. That's what it would look like from the side. Very amateur. Now I do want to make sure that you understand I am 100% for body positivity, like I said. But again, once I give these to you, if you continue to come back before you should, unless directed otherwise, unfortunately I can't let you back. That's kind of why we that's kind of why we manipulated you in the beginning, asking, you know, what was the reason? And I can completely understand, so it's no problem. Again, some people get this this for aesthetic value, and then others get it for medical reasons, things like that. I'm going to be taking this roller here and just measuring your face and looking at your face shape, okay? Okay. Ready? You're fine, just go ahead and sit back. Just get down here. Gonna look at your lips beforehand, just measure them up. Okay. So your lips are about 1.5 inches across and 1/2 inch. Right. So let me write that down before we do the injections, and then I'm going to go ahead and get that ready. Sign off on that. Okay. So, my dear, you did choose the angelic, correct? Where I push down with the Q-tip and we inject around? Okay. Now, would you like your lips fuller right here? Kind of like I have them, or? I don't blame you. Okay. Let me grab that. You know what? I almost completely forgot. I do have to look in your mouth very quickly. And the reason for that is because to make sure you don't have an active infection that I can see, I would be taking your heart rate. If you had any other procedures being done today, we also have cool sculpting, so I have to make sure everybody's calmed down whether or not we should prescribe them something before the procedure. So I'm just going to take one of these tongue depressors, one of these tongue depressors, one of these, and just gonna have you stick your tongue out and say, ah. Light, big light. Okay, just go ahead. Okay. Get close. Okay, open up again, say, ah. All good. So, I have the syringe right here. See, it's very thin. You won't even feel it. How do your lips feel right now? You don't know? Okay, I'll do a little test. I'm gonna just flick your lips very gently. Flick, 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 flick. Okay. Tell me if you feel it. How's that feel? Good. Okay. Are you ready? 100%. Okay. Here we go. I'm just going to press this down again right here and inject. Ready? Here it comes. Gonna hear little drippings. That's just from your lip absorbing. Okay. Almost done with the lower right side. Okay. Ready? Do it again on the left side here. Alright, I'm going to pull this up, and you're going to feel a little bit of swelling immediately. Push it together. Okay, I'm just going, you're fine. Just go ahead, relax, relax, relax. Okay, okay. Some people use magnifiers, but sweetheart, I promise you, mine are magnified. Okay. Just getting a little bit. Press. Gotta get this done before they start swelling up too much. Okay, I just need you to relax your mouth like this, because you're kind of closing it tight. And I'm sure you could feel the little hole right here that's... Okay, just go like this, go. Yes, like that. Okay, I no longer need this. I'm just gonna use my finger and press up against your upper lip. We're gonna be injecting in here, all the way down, and then up. And then I'm gonna be squeezing the top lip, okay? So let's start by lifting up your lip like this and just... Okay. Squeezing now. Pushing up, getting around the top now. Okay. You're doing great. You didn't even need the squeeze balls. Stress balls. Okay. Let's see how they look so far. Let's go ahead and squeeze. Okay, just go ahead and relax your mouth like this again. They are incredible. I'm just gonna put a little bit more just right here down around your lip, okay? I'm gonna put this down against again. Ready? Set that beside you. Wow. Absolutely beautiful. 1 second. Okay, let's grabbing another tongue depressor. Okay, open up real wide and like open your lips with it, okay? Go ahead. Just kind of smoothing the lips right now. Just smoothing. Smooth move. Excellent. Okay, let's see it now. Wow. Absolutely beautiful. You're all done. The only aftercare that I need you to make sure you proceed with is ice. You need a lot of ice. We have cool packs in the front from the brand itself, so I will absolutely make sure to get that immediately for you. And second, do not any sucking through straws, through other objects, anything at all. We want to keep you from manipulating your lips for at least 3 days. Your lips will be swelling up very, very much. Don't be alarmed. The only time you should be alarmed is if pain lasts for more than 24 hours. Tylenol can take care of that. I take that back. Do not take Tylenol whatsoever. It's a blood thinner. I want to stick to ibuprofen. Or maybe I'm wrong. We'll check up front. But either way, if pain persists for more than 24 hours, call me immediately and we will get you prescribed something just for a day or two. But other than that, there should be no blood, no leaking of liquid through your lips. You're all done. So, how about we go up front and take a look? But other than that, I can actually gonna have the nurse come in a bit to check you out, but I'll see you up front, and it was very nice meeting you. You have a good day. Bye.